very shortly after I started working in graduate medical education, I could really see what was called for from people that were either going through medical school or people that were going through residency, and actually how much they gave up of their own lives to do that and how rigorous the system was. Physicians and other healthcare workers see more of life and death than most of us ever will on a regular basis. And so how to meet their humanness too. That I wasn't the only one that went through something when my dad died. The healthcare team did too. And so, what can we do to make the whole system better? What can we do to change this for everybody that's a part of it?
Welcome back to Flourishing in Medicine, from Surviving to Thriving. I'm your host, Dr. Mick Krasner, and this podcast is produced by EmPro, a medical professional liability insurance carrier in New York State, who, through its number of different peer support programs, offers the opportunity to help support the professional lives of the physicians they protect. In this inspiring episode of Flourishing in Medicine, from Surviving to Thriving, Colleen Camenisch, Executive Director of the Nevada Physician Wellness Coalition, shares the deeply personal roots of her commitment to healthcare professional well-being. Sparked by the loss of her father to a likely medical error and the healing path that followed through mindfulness practice, Colleen's journey led her from outside the medical world into transformative work supporting physicians. Her story is one of compassion, resilience, and a calling to serve those who dedicate their lives to healing others, particularly amid the challenges and moral injuries experienced in modern medical systems. Throughout this conversation, Colleen details the grassroots evolution of the coalition from a response to physician suicides to now a dynamic statewide organization offering peer support, CME-accredited mindful practice sessions, leadership collaborations, and medical student mentorships. Her leadership, informed by mindfulness, focuses on systemic changes, emotional safety, and human connection. With a vision for national replication, Colleen highlights how community partnerships and shared humanity are reshaping the culture of medicine, one story, one conversation, and one active support at a time. And now, enjoy my conversation with Colleen. Welcome, Colleen, to Flourishing in Medicine, from Surviving to Thriving. It's just a thrill to have you.
I'm so happy to be here. Thank you so much for inviting me.
I'm interested in having this conversation specifically because of how your work, your interests, just your whole life in some ways has been oriented, maybe you don't see it this way, but I do, toward flourishing for health professionals, for individuals, for yourself, for your communities. So I'm really excited to talk about this. And what I wanted to start with, and I start this way with almost all the guests, is asking you kind of a question about why are you working in this domain of flourishing, of caring for health professionals. Now, I want to see if you can really take in the question in a slightly different way, that we're going to ask you to move beyond biography, beyond this sort of step-by-step chronology of how you instrumentally got to where you are today. And really, I want to hear about the why and the who.
Boy, that's a great question. And I'm sensing, vulnerability kind of rising up inside when I really think of the origin story. And I think for me, it's probably two parts, probably one part that I'll share secondarily, and then one part that felt like, I don't know, just chance. And maybe that's how life feels sometimes. And then you kind of realize, was it really chance, or is there, more serendipity to this than I would have thought? So my own dad died in the healthcare system, probably due to a medical error. And that happened when I was fairly young, had a significant impact on my life, which ultimately I would say led me to mindfulness. And then I didn't really start out my career path in medicine or actually thinking I would have anything to do with medicine. In fact, for many years, it was really difficult for me even to walk into a hospital after my dad died. And as the years passed, I was doing different jobs. I was kind of trying to find a job in the recession that was happening. And I randomly applied for a job at the medical school because it was part-time. And I really wanted a part-time job so that I could grow my career in teaching mindfulness programs. I thought, well, if I could have some kind of stability and enough stability that I could teach mindfulness, that would be a great combination for me. And so I'll never forget the interview I had. It was to be the institutional coordinator for graduate medical education. And I remember as they were doing the interview with me, I didn't actually know what graduate medical education was. I didn't associate that with residency, and they kind of corrected me during the interview. But I think that they could see my skill sets would actually be a really good fit for what they were looking for. And I think that also for them at the time, they really needed someone with like an MBA that wanted to work part-time and was kind of willing to be in this role. And so I think we both took a chance on each other. And very shortly after I started working in graduate medical education, I could really see what was called for from people that were either going through medical school because I had a chance to work with med students sometimes, or people that were going through residency, and actually how much they gave up of their own lives to do that and how rigorous the system was. And to me, it felt like most of these people sign up for this because there was some sense of calling, and I just really felt compelled to wanna help people that were doing so much for the community, giving so much up in their own lives. And I would say after all these years, it's been such a healing process for me too, knowing now what I know about medicine and the impact that burnout can have and the systems issues that are in medicine and how that can impact someone like me who loses somebody I love in that system. So I know how high the costs can be.
Well, thank you for sharing that. And it had to be just extreme. I can't imagine how difficult that was for you. And I'm curious if you'd be willing to kind of just go a little deeper into that about this calling aspect, this desire to help. You mentioned it in the trainees that you began to work with and for as this director of graduate medical education, but also your own calling, your own desire to help. One could think otherwise that you would have want to stay far away, as you mentioned. You didn't want to go into a hospital, run far as you can from medicine. But there's something about you, and that's what I'd like to explore a little bit, that really you were called in a certain way, and this desire to help. Where did that come from?
I guess one of the things I learned in losing my dad at an early age and sort of everything that happened around that is that you can be angry about those situations and resentful and harbor a lot of feelings and emotions that are heavy weights to carry, or you can try to look for the opportunities and what's possible. And I think certainly empathy and compassion are a part of that. And so for me, I think I have this sense of like, how can we turn the really difficult moments in our life into things that have meaning and purpose? And again, as soon as I got connected with the healthcare system, I think it shifted my perspective a lot into the ways we might perceive it from the outside as just maybe a patient or a person to what really happens on the inside. And I never felt personally angry at the people that were involved in my dad's care. It didn't feel like somebody made some intentional massive mistake. But being a part of the system and being a part of hearing people's stories and seeing what they face in the context of healthcare was like, I think for me, what mostly arose was this deep sense of compassion and like, physicians and other healthcare workers see more of life and death than most of us ever will on a regular basis. And so how to meet their humanness too. That I wasn't the only one that went through something when my dad died. The healthcare team did too. And so, what can we do to make the whole system better? What can we do to change this for everybody that's a part of it?
One of the things you are reflecting on had me think that something that you did was you were able to see the humanity in the people working in healthcare. And I think that's a lesson really for all of us to, especially those of us who provide healthcare as clinicians, that with burnout and with all of those struggles, the challenges, the systemic challenges, the organizational challenges, and the individual challenges, sometimes we lose that ability to see the humanity of others. We depersonalize things. It's one of the cardinal features of burnout, as you know. So, thanks for sharing that. What I'd like to do now, ask you to just kind of walk us through how you got to the Nevada Physician Wellness Coalition, and even if you can bring in some of the other streams that influenced you in your life, and if you could say something about that. It's a phenomenal organization. As I've done a little research on it, it's quite extensive. It's got great breadth and depth and a mission, which aligns with your own personal mission that you shared. So, yeah, talk to us about how you got to this desire and putting that into action with that first job in medical education to this position now that you have.
While I was I kinda said when I started out, I wanted to both teach mindfulness programs and have a part-time job, and so they were kind of simultaneously there, and I would say that's a thread that still connects me to this role right now, is knowing something about well-being, the well-being I had to do for myself, and then being able to teach mindfulness programs. And later I met you, and even in that case, I wasn't yet working with healthcare professionals directly. I was working within that context, but I thought maybe some next step could be mindful practice, and how do I actually bring this into the work of healthcare professionals? And along the way, I was teaching an 8-week course, and a physician came to my course. He's our very first board president for the Nevada Physician Wellness Coalition, and we kind of kept connecting around well-being. He was really passionate about physician well-being, and when the board initially formed for the coalition, they asked me to be a part of it, mostly because of the connection I had to Quinn Pauley, who was our first board president. And just to say a little bit about why the coalition formed, because I think that's an important part of the work that we do today, is that it formed because two physicians in northern Nevada died by suicide very, very close in time together. And a group of physicians got together and just said, how do we prevent this from happening? And Quinn Pauley at the time, working as a physician himself, said he couldn't open up any kind of like journal without seeing something about physician burnout and the cost of that, and also realizing that physicians have a lot of fear. And I think this can be true for other healthcare workers as well, but I would say physicians in general have a lot of fear about particularly licensing and what could happen to their job if they acknowledge these issues. And so there was really this sense of, could we create something independent and autonomous, not connected to an institution, where physicians could feel safe to actually share, what's happening, and to have resources that they might actually access, because we know, and this is particular to physicians when we look at other healthcare professions, that physicians have the culture of silence. They tend not to talk about what's going on. Even when I looked at, like, I did a lot of work around patient safety for a while, and even physicians were the least likely to report when it came to patient safety when we looked at other healthcare professions. So they have some unique issues that we felt we could maybe start to address as a coalition.
So, could you describe a little bit about what the coalition does now? It's certainly evolved because it's got a tremendous number of different kind of arms, tentacles, programs that it offers. One of the things I did want to mention is the psychological services for the physicians that are served by the coalition. As I understand it, these psychologists and behavioral health specialists have special training in physician stress in particular. And I did want to mention that one of our first episodes of this podcast featured Tina Runyon. You probably know Tina from Tend Health, who works in this very domain. So I'm sure there's a lot of connection there.
Yes, Tina is a good friend of mine, also mentored me in teaching MBCT. She's a wonderful person. And So it took us actually a while to figure out what to do. We first formed the coalition knowing something needed to be done, but then we were like, well, what do we do? What are some immediate actions we could put into place? So one was our resource line. It's not just for physicians, it's also for their family members, knowing that sometimes the family members might be the first ones to know something's happening, or the only ones that know that a physician might be struggling, or that those family issues somebody might be having could be impacting a physician at work. And so we had 2 psychologists, one initially who volunteered just to be a part of the coalition. He also was a colleague with me at the medical school I worked at, so he had a lot of experience working within that context. And then he recruited another psychologist in Las Vegas. We have a huge state there, and so we wanted to make sure we had representation in sort of both areas. And both of them also created a network of other clinicians they knew in the community that had experience working with physicians and that would get physicians in a relatively short period of time. We have a huge mental health care shortage also in our state. And so that was one of the first things that we did. We kind of created this resource line, created a network of help that could be easily accessed. We still don't get as much utilization as we would like to get. Now we're thinking about actually adding peer supporters to that resource line because we know that, especially with physicians, again, I know I'm talking a lot about physicians and not saying these don't apply to other healthcare professionals, but there are some specific things with physicians where we know they prefer to talk to a peer than anybody else when they're really struggling. And so we're thinking about incorporating that too. And then I had been trained in the mindful practice curriculum. So I said, why don't we start, offering this and just see what happens with it. And that's now one of our flagship programs that we do. We do it in a little bit of a modified way, 1 hour CME sessions. And then we also, I mean, we were just launching our programming right when COVID was happening. We were supposed to have Tate Shanafelt be a keynote speaker here in Reno. And then it became quickly evident he was not going to be able to do that because of everything that was happening. And so we switched to an online platform, which you graciously did some of our very first speaker series sessions as well. And that turned out to be a catalyst for us because we went from being a Northern Nevada Physician Wellness Coalition to realizing very quickly we could reach people statewide. And that by putting it online rather than having in person sessions, we got much greater attendance. So we usually have like 100 people sign up for our speaker series sessions. We get, 60 to 100 signing up for our mindful medicine sessions. It's been incredible to see how much utilization there is.
Sounds incredible, and there's so much going on in your organization now. I'm wondering if you could highlight a couple that I read about that are part of what you're talking about. One of the through lines in what we're discussing and how you're presenting the history of this is collaboration. And so I'm sure your approach is highly collaborative and it has to do with connection. And we'll come back, I hope we'll come back to the influence of mindfulness and how that informs all of this work for you as a leader. But if you could say something about 3 areas, it's a lot maybe, the hospital leadership working group, the medical education working group, and the medical student well-being mentorship program. These are 3 things that I thought were really striking, unique, but connected efforts of the coalition.
I mean, one of my favorite things about working for this coalition, as opposed to any other organization I've ever worked for, is how organically everything has happened. So, like I said, initially we started with the resource line and programming, so really focusing on individual well-being. But what was challenging for us about that is every time we had like a roundtable discussion about it, it's like people are going back into systems that are broken and where there's a lot of issues. And so it felt a little bit like a moral injury to us, like how we're trying to help people that we're putting back into broken systems. How do we start changing that? And so just this year, we hospital systems sponsor us throughout the state. We have many, many hospital systems, both in northern and southern Nevada, that sponsor us. And we started thinking like, could we work with the leadership teams there to start to impact systemic change? And and if we did this as a statewide collaborative effort, we could all learn a lot from each other because there were some systems. I get the pleasure of getting to work with lots of systems and seeing what's working well and places other systems are struggling. And rather than the systems being in competition with each other, like how do we serve the whole state? by collaboratively working together. So that's something we started this year. We're using the AMA Joy in Medicine pathway as sort of like our overarching goals. And it's been incredible to see what we've started to form, one of those being peer support training for all the hospital systems. That's a part of the AMA Joy in Pathway criteria. We just did well, we had Dr. Joe Shapiro come in initially and do some training with us on how to do that, and then we kind of thought, "All right, how do we start exposing people to scenarios, and how do we help people recruit peer supporters at their hospitals? And then once they have them, how do we help them systematize it so that the hospital actually takes action on it?" So we just had a peer support training. We're doing these follow-up trainings now that we're kind of self-guiding. 30 volunteers from across the state that are willing to be peer supporters came for an hour and a half training. So, I mean, it's incredible the momentum there. And then because people, I mean, everything that's happened through the NPWC, the Physician Wellness Coalition, has basically been community collaborations. Like the medical board advertises our programs to the community. That was a huge help for us. The medical schools in the state advertise our programs. Every physician facing organization in the state we work with, and they advertise for us. So this has been a huge part of our success. And as people heard more and more about us, the medical schools started reaching out, like, what can we do for residents? How can we work with you? And then the med schools started reaching out. And actually our medical school mentorship program that you're talking about, this came from a med student who's on our board. She was really curious about what could we do to create a physician mentorship program specific to well-being, because we know how quickly the stigma starts. It starts very early in medical school. People are like, well, if I disclose that I have a mental health issue, will it impact me getting into residency and my whole career? And so we wanted to have a forum with a physician, and we had a lot of physicians that were doing well-being. So we started recruiting from our own physicians that come to the programs. And last year at UNLV, we did a pilot program we had 24 mentees and 8 mentors, and amazing mentors throughout the state. And I think only one mentee dropped out of the program. Many of them are going to continue into the next year. They didn't want to give up that mentorship. And it was really cool. At the end of the year, both the mentors and the mentees said how much the experience had meant to them. And so many of the mentors were thinking like, I wish I would have had this when I was going through medical school. And we really tried to make sure the mentors were not connected to their educational experience in any way, so that they felt really safe in disclosing what was coming up for them. And then we also started a medical education working group. And so it's a collaborative effort across all the different residency programs and medical schools throughout the state, where we're collaboratively thinking about how can we move medical student well-being forward, and how do we do that as a team and maybe create some unified effort. So it's been so lucky, because in a lot of organizations you wouldn't be able to do that, but because we're totally neutral, it's been so heartening to see how much more we can all achieve together and not in competition.
As I was looking through your materials and the organization, I came across something about assessment, how you assess the impact of the programs. And I'd like for you to speak to this audience who probably don't have much familiarity with this Net Promoter Score assessment, because I think it's a really interesting way of looking at and reflecting on, are we doing good work? Or is it having impact? How do we measure that? How can we report that? So can you tell us a little bit about that? It's kind of a little sidebar, but I had particular interest in it. So I thought you could share with us a little bit about the Net Promoter Score.
So our operations manager, Shanna, who's like an amazing counterpart to me, she came up with this idea, and it's a relatively new metric for us. So I can't say I know tons and tons about it, but just this idea that we wanted to measure, the impact of our programming. How likely are you to come back to this program? How much did it influence you? And we have extremely high net promoter scores, actually, which I think says a lot about the continuity of the work that we do and how many people come back again or refer somebody to the program.
I'd like to just shift, if we could, Colleen. Now, I want to go to a topic that, is very, in some ways, personal, but very important for you, which is the mindfulness training. You've alluded to it a number of times. And I'd like you to talk a little bit about how it's informed your work, and connect, if you can, the how you conceptualize mindfulness, how you embody it and work with it, and how it informs your leadership and also the development of an organization like this. You've devoted so much of your life to practice, mindfulness practice, training, embodiment. And I'd like to hear about how that really has a very real impact on how you step into this role as executive director and help this organization flourish.
I mean, I think a part of what mindfulness has helped me do personally is to find a way to meet uncertainty. So one thing about the Nevada Physician Wellness Coalition, we know there are other kind of coalitions out there. We don't really know of other coalitions doing the kind of work that we're doing in this way. And so like I think of this a lot because I have a business background like a startup. It feels a lot like being in a startup, and a lot of the times we're, I always say we're like building the plane while we're flying it, and we're adjusting and pivoting, even financially, just to get our bearings and to get the kind of support we needed to a brand new idea, something nobody has done before, something people don't really necessarily get. It's not easy, and there's a lot of risk and uncertainty. And so I think for me, I've really turned into my mindfulness practice of one, trusting the process. Like, I really believe that there's something here. Right now, a lot of what we're thinking about actually is how this model could be replicated in other states. And we're just starting to talk to other states about that. So, like, I know there's potential here. And I know other people aren't going to see that potential right away. And so, like, how do I actually hold the uncertainty and hold the ambiguity? And also hopefully provide visionary leadership where I can keep other people engaged and willing to keep taking the risk. Like I mentioned, Shanna, my great counterpart, she's taken a lot of these risks with me and kind of trusted the process. And I really feel like mindfulness has given me the capacity to stay right in the middle of uncertainty and not knowing, and be able to hold like a mostly steady ground. Some days are better than others, but I think that there is something to, yeah, it's like we can see it through the community. There is a momentum here that deserves a chance, but I'm not sure everybody could have really stood in the midst of that same kind of ambiguity in the same way. And then, of course, I hope that as best I can, I'm seeing things clearly and not from a reactive standpoint. I would say that's the other thing that mindfulness really helps me personally with is, so like, where are the places we need to grow as an organization? What are the gaps we're not meeting? I think again, this was a big part of inspiring the systemic changes. Like, we can't keep doing one thing and then leaving people out there. Like, how do we keep meeting those? And then hopefully like the spaces that we can hold too. It's, as teaching your own curriculum, the types of conversations that come up, the topics we bring forward, like, you really have to have a strong center and presence and the ability to hear and hold what's arising in those spaces. So I think that's another key piece for me, because I'm not just running the organization, I'm still facilitating the programs, which I love because it really keeps me in constant contact with, what's there. Actually, I was teaching a session on noticing, and you have this picture in there that I think comes from I think it was published in JAMA, of like a little kid drew about their provider being on an EMR, right? And not looking at them. And it's this very clear depiction. And it was so fascinating. In the last session I taught, someone was saying, like, I've started using an AI scribe and it's actually changed that scenario for me. And it just helped me remember, like, oh, we have to keep evolving. Things are still changing. Like, the EMR might not be, or the EHR might not be the thing that's how it was before. And so there's this evolution that I'm hoping that quality of curiosity that we cultivate from mindfulness can keep helping me follow that thread of, like, oh, what's here now? What's here in this moment to be attended to? So I don't know, maybe those are some of the things.
So, as also a teacher of mindful practice, I struggle sometimes with the following that I'm going to ask you to reflect upon. And it's, you have this training, you have this background, and even the organization, the coalition, offers some training in mindfulness, but you don't, we don't need everyone to have that level of training or even the training at all in mindfulness in order to find ways to manage within the current healthcare system, to cultivate ways to transform their lives in work, their personal lives, infusing their lives and work with meaning, purpose, energy, acceptance, awareness of our limitations, the challenges of shame and stigma and perfectionism, which we have to confront, we have to work with. It's just part of the environment and part of the human experience. So I I struggle with this. I'm wondering, how do you kind of carry that, but realize you're not taking a small group of people and really intensively transmitting to them what you've learned in mindfulness, but it's informing your work. How do you feel about that?
Yeah, I mean, I think it's been a little bit of an evolution. So your curriculum is called Mindful Practice. We decided to call it Humanism in Medicine because we felt like that might be a way that people could connect with it without thinking they necessarily had to take up a mindful practice. And unfortunately, one of the things we discovered is we didn't have that much time with people. Like healthcare professionals in general are busy. And so we teach 1 hour, well, I teach 1 hour sessions when I do it, which means I often actually don't have that much time to do a mindfulness practice. And so for me, when I was starting to pare down the curriculum, like what is the most important part of it, and this is just my lens, I just was so aware that when people were going through graduate medical education, you're learning as a physician or any healthcare provider how to deliver bad news or how to help a family that's suffering in the context of making a difficult decision about a loved one, but you're getting left out of the scenario, and to me, that felt so powerful even when I did the trainings and was watching physicians just early on going through this program, that they have a story too in the context of all of that care. And to me, that's what really gets highlighted in these sessions is the reframing of being with suffering or grief and loss or when things go wrong in unique ways that aren't punitive or fear-based, but really to think about the humanness of that and then to let people share their stories, which they often don't get to share and yet have so much meaning or could like reframe a whole situation that happened just by hearing it reflected back through another provider. And so to me, that's like the heart of what we do in those sessions is we really give people a space to connect and to share their stories in meaningful ways, and that changes a lot.
Yeah, that's really helpful. And in fact, just parenthetically, we in mindful practice in medicine really struggle in our working toward some way of the nomenclature, the lexicon, even of what we call our program, for that very reason, because it sets sort of an expectation for very highly achieved and perfectionistic people to feel like, oh, I have to do that. I have to become now a mindfulness expert. And we're actually, in our language and our description about our programs, we're really moving much more toward talking about flourishing in medicine. But I like humanism in medicine. Is terrific. So we're winding down, Colleen, to the end of the conversation. It's been a great conversation. I wanted to ask you something that I ask other folks that we meet with, that we have on the podcast, and it's really sort of a thought experiment, and it's an imagining that it's 3, 5, 10 years from now, and the success that you've had in the Nevada Physicians Wellness Coalition has just been even beyond what you've achieved so far, and you've met all your objectives. And we're now in a world, however long from now that is, you're inhabiting this environment 3, 5, 10 years from now, where all this work is paid off. Health professionals are feeling connected, shame competent. They're sharing their stories as you described. They're working with high quality outcomes with their patients. The patients are feeling satisfied. They're feeling meaning. And I'm interested in a couple reflections, and you can cover them all. You can just cover part of them or just impressionistically decide where you want to go with it. But what would it be like for you in this imaginary world that we're not in yet to work there, to be the leader of this organization, to do the teaching you're doing at the grassroots level? What do you think patients would experience in healthcare in this imaginary world? And what do you think your colleagues, the physicians that you serve, and the other health professionals that you serve would experience? And then finally, one or two things that you know you have to do to get there, because you've already reflected on an analysis of, what are you not doing? So really, this imaginary world, what would it be like to work in that? What would it be like to receive care in that setting? And what are one or two things that you could offer that you know that we need to do?
Mm. I mean, I'm just thinking of some of the reflections that I sometimes hear in the sessions, which are really around how when people get to share their success stories, how amazing that is to remember the work that actually gets done by the healthcare team. I mean, I think it got really highlighted during the pandemic. Like, people really knew, like, every aspect of healthcare, down to the people that are, cleaning the hospitals. Like, every single part of that ecosystem is so, I think, critical to society actually being well. And so I can imagine that if the physicians and the healthcare team all felt like safe and valued, and like they actually, like, to me, the biggest thing I hear is like that the time for patient care. I mean, most people go into that profession because of the calling to care for people. So to really get the chance to do that, I think the whole community would feel different. I think the community would be well. We know that burnout is tied to patient outcomes. So the opposite, it's like bad patient outcomes would probably shift to good patient outcomes, better patient adherence, like all those things that we think, even in the context of lifestyle medicine, we know how important that is. But there has to be enough patient adherence to make that happen, and we know that that's very likely a pathway through the healthcare team that they connect to. So I imagine a society that is healing and healthy and maybe even more proactively well. And I know that parts of that are already true. So I also try to remember that that's not just some imaginary thing, that those moments are happening all the time in healthcare. And it's so beneficial when the healthcare team can remember how much impact they have on the community and how much we value them. So I just want to include that piece. And one of my favorite parts of working with any member of the healthcare team really is like the depth. Like, there's so much depth and wisdom and like a profound nature to the people that are in that because of what they see, because of what they witness. And I would hope for them that that gets to really come to fruition in their life, that they actually have the time to process all of those moments and events, and that that could be a powerful source of wisdom. And it's like really feeling actualized somehow in the world through your experiences. Like, it's already there. That's what I love about mindfulness. It's like just remembering and tapping into. So I would hope that that gets to be more brought to the surface for both them and their families, who often actually also sacrifice a lot in the context of someone having a medical career. So I think it would be amazing to work in an environment like that, and I mean, I already feel like that. I feel like I get to be, like, reciprocally receiving so much from that environment. And then I guess my hopes for the organization in the best case scenario is that we can start to replicate in other states. We have a roadmap that we've been able to systematize, and that's working really well. For me, the biggest roadblock I know will be funding. It's like we're predominantly funded right now through Medicaid reinvestment funds in hospital systems. So that's an immediate concern based on what's happening. What's been the coolest part of working for this organization is how much momentum it's had on its own, how much organic growth. Like, we keep meeting our mission in ways we couldn't even have hoped to. Like, the amount of physicians we've reached in Nevada in such a short period of time. And by the way, half of them at least have come to like at least more than one program, but many of them come to multiple programs. So it's like if we had more resources financially, I think the potential could be so incredible for what could be achieved in organic grassroots ways through community partnerships like we've done. So,
Well, thank you for that, and thank you for the reminder that parts of that imaginary future are already here, that we can actually experience parts of that in many, many different ways. And that's a great reminder of the appreciative influence of really looking at things from a strength-based approach in what we have. Well, it's been a wonderful conversation. I've just thoroughly enjoyed it, and I wish you and the coalition great future success because I think it will impact all of our successes. So thank you, Colleen.
Thank you so much, and thanks for all the ways that you've contributed to this really coming to fruition. You've been a huge mentor and role model to me, so just appreciate you very much.
Thanks for listening. We will include a summary of today's podcasts and some details about Colleen Camenisch and other references in the show notes. I'd like to conclude by sharing another practical exercise to help you flourish. It has to do with something that Colleen reminded me of, the Physician Well-Being Index. Whether you're a physician or not, we can engage in a quick way of actually assessing our own well-being through a quick body scan practice to ascertain how we are. We actually know how we are through our amazing capacity to interocept. That is, to know how we are in this moment simply by placing our attention on sensations, feelings, thoughts that we're experiencing. Let's do that right now. Just noticing what's going on. How are you? Sensations in your body, just bringing awareness to them, bringing awareness to the stream, seemingly endless stream of thoughts, and also a sense of the emotional experience of this moment, pleasant, unpleasant, neutral. One thing to note is it's not so much a goal to feel any differently or better than you are in this moment. The idea here is to know through the senses, through our affective awareness, through our cognitive, intellectual awareness, what's going on right now, what's actually here. And with that awareness, perhaps we can affect the experience of subsequent moments and how we are in those moments. Kind of our own well-being index, if you will. You may want to try it from time to time. I hope you found this podcast and this simple exercise useful to you, and I look forward to you joining us again for the next episode of Flourishing in Medicine, from Surviving to Thriving. And if you'd like to learn more about EmPro, please visit www.myempro.com or www.myempro.com/peer-support to learn more about EmPro's peer support programs. If you're a physician or a medical student in need of more urgent support, please consider calling the Physician Support Line at 1-888-409-0141 or www.physiciansupportline.com. For more information about me and the work I do, visit my personal website at www.mickkrasnermd.com or www.mindfulpracticeinmedicine.com. Until next time.